Hi, I'm Nasrien, and I have Dia with me, and we're fellows with Fits on the Go, and today we'll be interviewing Dr. Carabello.
Thank you.
So we just have a few questions for you today. The first one, we just wanted to know what you thought the top highlights of ACC 14 were so far.
Well, certainly Dana Carvey was spectacular, and his 15-minute stand-up was hilarious. From a scientific standpoint, the two late-breaking trials that followed that, the results of the core valve trial and then the results of renal denervation, I think were two very key important trials. Of course, my interest is in valvular heart disease, and the TAVR data that have come from all corners have been spectacular and very informative.
That's great. And in your years of practice, what would you say the top three innovations in cardiology have been in terms of changing the way we practice medicine today?
Yeah, well, so back when Louis Pasteur and I were friends, when I was a fellow, the only cardiac imaging that we had was a chest X-ray, M-mode echocardiography, and contrast angiography. If you look at the spectacular the explosion of imaging techniques that so allow us to more precisely determine cardiac function, shape and size, non-invasively or invasively, have been amazing and have certainly led the way. EP, when I was a fellow, was essentially reading a scalar electrocardiogram. And we've changed, obviously, radically from that. If you look at it, none of this stuff would be possible without the concomitant evolution of computer science. All this stuff is based on computers that weren't developed just simply to make medicine advance. And then finally, well, I can't leave it to pharmacology. The treatment of angina when I was a resident essentially was nitroglycerin. Beta blockers had just been, propranolol had just been commercialized, and that was it. And if you look at what we have today to treat heart failure and ischemic heart disease medically, it's quite amazing. And then, of course, interventional cardiology didn't exist when I was a fellow. And so if you look at first PCI and now structural intervention, it's been an explosion.
So, Dr. Carabello, where do you see the future of cardiology going in the next 10 years? 10 to 15 years. What do you think is going to happen to most of the fields? What's going to be the highlights of the field?
I think we'll have to be more frugal in how we practice medicine. There is going to be an effort that needs to be made for cost containment. But that doesn't mean that we're going to avoid life-changing therapies. I think you'll certainly see a continued evolution of pharmacology, more targeted towards gene-based therapies specific to individual patients. Obviously, what we're talking about today in TAVR is going to evolve incredibly. It's an emerging technology. 30 years from now will be quite, or 10 years from now will be quite different from where it is today. And I think that you'll continue to see refinement in imaging, more specifically what images to get when. And but there'll always be a place for cardiologists. We're not going to go anywhere in the next 10 years.
Which is a positive note. And last but not least, I guess for all the fellows out there, what's your advice for all the fellows before we finish training and in general in our practice?
Well, find something you love and do it. People that are passionate about any given discipline excel at it, and there'll always be room for excellence. And I don't think, if I were a fellow now, I don't think I'd be too bothered by what's going on in medicine. Cardiology becomes increasingly more specialized, not less.
Yeah.
And the idea that there are going to be a bunch of Marcus Welbys, you probably don't even know who Marcus Welby was, do you? But
Nope.
That's okay. The idea that there'll be a bunch of general practitioners that can handle everything is silly. Each area of cardiology is going to become more and more specialized, and the need for specialists will grow, not shrink.
That's a really good point. Well, we were really honored to have Dr. Carabello with us right now at ACC 14 on the Fit on the Go blog. If you want to check out more videos, you can go on the ACC website, but you can also check them out on youtube.com/fitsonthego. Thanks a lot.